One. Hey everyone, it's Matt Donaghue and Ken Hamilton with Mission Financial Planners. We are going to be talking about managing healthcare expenses in retirement today. Um, just a couple key housekeeping items for you. If you do have any questions or anything while we're talking, feel free to go ahead and throw it in the chat. We will answer those questions as we go, but we're going to jump into it. From a planning standpoint, there's really three key points you need to really make sure you understand with Medicare. One is if you don't enroll in Medicare on time, you will pay a monthly penalty and that will follow you for life. Two is if you don't go with the right private insurance to go with your Medicare, you most likely will pay too much in out-of-pocket costs overall. And three, and this is probably the big one in a retirement plan, is if you don't plan for higher healthcare costs in the future, you could run out of money or just not be able to get the care that you really need. So we're going to go through a couple key things today. What is Medicare? Who needs to enroll? How do you enroll? We'll talk about what it costs, what it covers, more importantly, what it doesn't cover, and then how does private insurance work with Medicare. In addition to that, we will talk about why your healthcare costs are going to go up. If you checked our weekly blog post that went out this week, you'll notice that we had a section in there about healthcare costs and how for those of you who are taking really good care of yourself, guess what? You are going to pay more in healthcare costs over the course of your life than someone who doesn't take care of themselves because on average, you're going to live longer. So that's a little sobering, a little counterintuitive for some people. And then, of course, we will talk about long-term care a little bit as well because Medicare does not cover long-term care. The way we'll work it, I'll take us through part one. Ken will take us through part two. I'll take us through part three, and then Ken will go ahead and wrap up for the end of the workshop today. Ken, before I jump into it, any big questions, anything that you think people really need to make sure that they pay attention to in this presentation or look out for in this presentation?
I think that the biggest thing is just to be thinking about yourself, be thinking about your parents, some of the people you've seen age through their retirement. Know that there will be some overlap, but there's also going to be some key differences, particularly around life expectancy. Maybe you've seen some loved ones pass away earlier in retirement. The reality is that there's treatments coming out every single month that might have knocked you out a couple years ago, but will likely extend your life in the future. So just know there's a lot to this. It's a part of your plan. But yeah, medical is a big part of it. Go ahead,
All
Matt.
right. All right. Well, we'll jump into it. Let's talk about enrollment. Okay, so who pays for healthcare in the US? Before 65, a lot of people are covered by their employer. There's also some retiree health insurance that some employers offer. COBRA is like a transitional where you have 19 to 36 months basically a coverage that you have to pay the premiums for. You might be getting individual insurance through the exchange, or maybe you're just self-funding. Maybe you're just writing a check for yourself. But after 65, even if you're still working, even if you're still covered by, say, your employer plan at work, Medicare does become the first payer. So, and that, of course, is except for employer plans that cover 20 or more people. But what that essentially means is that the bill will go to Medicare first, and then your insurance will take the remainder of the bill. So that helps lower costs a lot for a lot of those programs. Another thing to think about is that the key point here is if you're covered by that larger employer group plan, you don't have to enroll in Medicare at 65, but your employer might still want you to. They might still tell you to. And the reason why is because of what we just covered on the previous slide, that Medicare is the first payer. It helps get their insurance costs down. So don't be surprised, even if you're working for a larger employer, if you're asked to enroll in Medicare once you turn 65. Okay, if you don't enroll on time, you're going to end up with late payment or late enrollment penalties. You could have a coverage gap. You might not be covered for a period of time while you're waiting for Medicare because maybe you can't afford insurance. And then based on some of the health conditions you might have, your private insurance options just might be limited. They might not be affordable to you. So what is it? What is Medicare? Well, it is a national health insurance program. the Centers for Medicare and Medicaid Services is who manages it, and you enroll through the Social Security Administration. Now, this is a key point. Enrolling through the Social Security Administration, you call them at 65, you say, hey, I want to sign up for Medicare. And what they'll ask you as well when you call is, hey, do you want to take your Social Security check? Well, that's one of the reasons you want to have a good retirement income plan, because you may or may not want to take your Social Security at 65, but they'll make it sound really good, because if you sign up for Social Security and start getting your checks, they just take your Medicare premium out of your Social Security check. Otherwise, they send you a bill once a quarter for your Medicare premium. So don't get caught in that trap. Do some analysis on Social Security. Do it with us. We do that kind of analysis for all kinds of people. And then more importantly, see how that fits into your bigger plans for retirement. All right. So who's eligible? You have to be over 65, you have to be a U.S. citizen, and you have to be a legal resident who has lived in the U.S. continuously for at least 5 years. We hear a lot of people say, oh, this person's getting Medicare, that person's getting Medicare. They're not. Okay. U.S. citizen, legal resident have to have lived in the U.S. continuously for at least 5 years. Now, some of the people who are eligible under 65 are because they are on Social Security disability. So they're dealing with a very serious disability that has got them on the Social Security system, and Medicare is paying for part of their health care costs. Medicare really gets broken down into three core parts. There's Part A, Part B, Part D. And you'll notice I skipped Part C. I'll talk about that in just a moment. Part A, right above my head there. Part A is your hospital insurance. Part B is your doctor's visits, so your medical insurance. Part D is your prescription drug coverage. A Medicare plan, or a Medicare Advantage plan, commonly referred to as Part C, is going to incorporate elements of all those, and may also, through a private insurer, get you some of the supplemental coverage that you're looking for. So you get A, B, or D. You want to go get them on your own, you go right ahead, but a lot of people like to just have it all bundled together for them in a Part C plan. So again, you want to go get it on your own, hey, fine, you go right ahead. You go sign up with Social Security Administration for Part A and Part B. You go find your own prescription drug plan, and then you go find your own supplementary insurance, otherwise known as Medigap insurance. You can see that on the left. On the right, the Medicare Advantage plan is going to incorporate the first three, the A, the B, the D. Okay. And then that insurance company will most likely take you through some of your options for the supplemental coverage as well. So it's a little bit more like one-stop shopping when you're dealing with what type of plan to have. The way you enroll in Medicare, hey, if you're getting Social Security at 65, we already touched on this. Part A and B is automatic. You can decline. Coverage will start the first of the month that you turn 65. Medicare Advantage plans and prescription drug coverage are not automatic. You do have to choose private insurance companies and proactively enroll in those. So just keep that in mind. Part C and Part D are not automatic. You do have to choose. If you're not getting Social Security at 65, you have to sign up through the Social Security Administration during one of their enrollment periods. There are three enrollment periods. Okay, there's the initial, there's the special, and there's the general. Initial, you're not covered by a group plan. Special, you're covered by a group plan. They're asking you to sign up anyways. General, I blew it. I flubbed it. I didn't sign up. I got to get signed up. When do I do it? I do it during that general enrollment period. So your coverage will begin if you sign up the month before you turn 65. Your coverage starts the month you turn 65. If you sign up the month you turn 65, it starts the next month, and you can see it's the next month. So what I tell a lot of people to do, and I know Ken, who is a long-term planner, has it on his calendar already, but your coverage, right, call them 90 days ahead of time. Right? Just make sure, because the scariest thing about that is coverage gaps, right? Maybe I can't get the insurance I need because maybe it's out of reach financially for me. Maybe I'm going to end up paying through the nose for it when I didn't need to. Maybe I have to wait for a special enrollment period to be able to get signed up. There's all kinds of potential issues there. Okay, so just 90 days before you turn 65, call them. 30 days before you turn 65, that's when you want to sign up. Okay, so who signs up for Part A during the initial enrollment period? Pretty much anyone who's turning 65. And keep in mind, I know I've said it a few times, if you're covered by a group plan at work, if the employer's asking you to sign up, then go ahead and sign up. You do not, if you're at a small employer, you're going to sign up anyways. Hospital coverage, which is Part A, doesn't have a monthly payment that you make for it, so this isn't going to hit you for anything out of pocket while you're signed up for it if you're still working, or really at any point for that matter. The people who sign up for Part B, this is your doctor visits and things like that, which does have a monthly premium. Part B sign up is generally driven because you're either not working, you're self-employed, and it's a lot cheaper than the insurance you're getting otherwise. Maybe you are employed by a small firm that has less than 20 employees. You were on COBRA, you were on that transition healthcare coverage that I mentioned earlier. Your employer from your retiree health benefits plan, that employer has a requirement that you have to sign up for Part B. Or maybe you do have insurance through work, it's just not very good, and you want to sign up because you think this will be better for you. A lot of the same mindset goes up for Part D or applies to Part D. You've got two options with it, though. One is standalone prescriptions. The other one is a Medicare Advantage plan that's going to incorporate that in. So again, you can go shopping for it. You can call an insurance company and say, or ideally, you're going to call an independent insurance agent. They're going to find an insurance company for you that fits your needs. But Medicare Advantage plans that include drug coverage, hey, that's fantastic. You got A, B, and D all together. All right, I blew it. I missed it. What do I do? Well, if you didn't sign up for Part B or Part D during your initial period, okay, and let's say you didn't do it because you were covered, right? Or you're essentially covered. For Part B, you can get signed up anytime before your coverage ends, and there's an 8-month window after your coverage ends to get signed up. So you got a little bit of grace there. Okay, you forgot to sign up before you retired. Oop, call them right away. Again, call them 30 days ahead of time. If you know you're retiring on October 1st, call them now. Don't wait. Don't wait at all. Okay. Part D, you have 63 days after your coverage ends. Folks, I have no idea why one is 8 months, one is 63 days. I don't know why it's not uniform. That just, I have no clue on that one, but 63 days. So the same mindset, right? You're a month or two out from retirement. You need to be calling on this stuff and getting it lined up so you've got it. So best time to sign up during the initial or special enrollment period. Best way to make sure you don't have a coverage gap, sign up before your current coverage ends. Everybody I know who's done that, the coverage has been really seamless. Okay, they go off their old provider, now they're on the new provider, and it works great. It works great. All right, you flubbed it big time now. So you're not covered by work and you didn't forget to do it, because you were still working, right? You're just not covered because you forgot to do it. There is a general enrollment period, which is January 1 through March 31st of every year. Your coverage will begin 1 month after you enroll. Okay, think about this for a second. Let's say my birthday is in March and I forgot to sign up. Forgot. Guess how long I have to wait to try to sign up? At least till January. So now I have 9 months potentially where I'm not covered. I have to go find my own insurance, wing it, right? Hey, hopefully nothing happens, whatever. But you've got a 9-month window that you've got to figure it out. So don't put yourself in that position. In addition, remember when I said there's late enrollment penalties? That will apply to this. They kick in at this point, and now you're going to pay that extra surcharge for the rest of your life. It's not worth it. Okay. It is not worth it at all. So if you take anything out of this first section, it is sign up early. Okay. At least 30 to 60 days ahead of time before you're either A, turning 65 or you're going to retire. Okay. Sign up early. If you missed it, there is that general enrollment period that's open during the first quarter of every year. Hopefully, you're not someone who's like a March birthday and you missed it. Hopefully, you're a December birthday and you missed it, right? Hopefully. And then keep in mind, if you're covered by an employer plan and you forgot to sign up, don't sweat it. You do have 8 months from the time your coverage ends to find to get signed up for Part B, and then for Part D, you have 63 days. All right, Ken. One last thing. To sign up, you can go to ssa.gov or call the Social Security Administration at 800-772-1213. And the Medicare.gov website is actually fantastic. There's a lot of great information on there. So if you really want to learn more, you really like to absorb stuff, that's a great place to go. If you want,
Oh, your mic just cut out. But yep, how to sign up for Medicare Part D. You have the ability to go with original Medicare and sign up with A, B, and D, or there's the way that you can bundle it with an Advantage plan, and that is Part C. Um,
can you hear me now?
we'll be talking. I can, yep. We'll be
Okay.
talking about the alphabet soup that is Medicare, even more so. So if you are taking notes, good luck. More, let's be honest, just go ahead and reach out to us for any questions and clarity that you need. But the next slide is actually mine, Matt. So I'll just keep
Yeah.
going. So
All right.
now that you got all signed up for Medicare, you understand the types. Let's talk about what the costs ultimately are. Now, these numbers are from 2016, so just keep that in mind. The average total out of pocket was about $5,400 on an annual basis. 2,200 was premiums. You've been paying Medicare premiums every single paycheck of your entire life. They continue on throughout your retirement. But then there's the actual services that you're going to be needing and taking advantage of, everything from your prescription drugs to dental services. And so your average out of pocket a decade ago was about $5,400. So what, next slide. So when we're talking about it, premiums, there's the Part B premiums that you'll be paying for, but then also Part D, which is your medication. But then there's going to be other out of pockets, like I mentioned, the deductibles and the premiums. But then also there's going to be services that you're needing and wanting that are just not covered by Medicare, and we'll be talking more about that in a moment. So the way it breaks down is there are the three main parts, and we'll talk about traditional Medicare, so A, B, and D. Part A is effectively free. That's what you've paid for your entire time. And Part A is for the hospital visit, if you will. So if you've paid your 40 quarters, your 10 years of substantial earnings, you have Part A for the rest of your life. But Part B is what you would most people think of as your primary medical insurance. And that starts at $185 a month. Then there's Part D, and this is probably the one thing that makes sense in Medicare. D is for drugs. So if you're thinking about Part D, think of the prescriptions. So, and that helps cover some of the costs associated around that. Now, on the next slide, I talked about Medicare premiums start at $185 a month. And when we talk about Medicare planning and why it's so important, I mean, I imagine there's some people that are listening to this are thinking like, what's there to plan for? It's going to happen. But Medicare planning needs to be a part of your tax plan, needs to be a part of your income plan, because if left unchecked, your Medicare cost, your medical cost could be blown out of the water just because we didn't take a couple of moments to look at it. Now, I want you to focus in on that second column. That's MAGI for joint. That's the modified adjusted gross income for a joint household. The more money you make, and then you look at the far right column, the more money you pay per person. So let's take if you want to hover over the 266 and 334. So you're in this household, right? Let's just say you're making $270,000 a year of gross income. You have pensions, you're taking your RMDs, all these things are coming out. As a per person, you're paying $405 a month. What are some of the things that maybe you could have done in your 50s and 60s to reduce that number? where they're Roth conversions, so the income you're distributing from is now tax-free and it doesn't show up there? Maybe, right? But now let's take it one step further. Most people that enter retirement married don't end their retirement married. And I don't necessarily mean divorce. I mean, statistically, one person might pass away. And so if we're at that 270 of income, now your modified adjusted gross income as a single individual, you are in the second to highest bracket. And now you're paying $670 a month for yourself. So you were paying $800 a month for the two of you of just your premium, no doctor's visits, no deductibles. You were paying 800. One of you passes away or you get divorced or something to that effect. Now you're paying 670. Not for better doctors. You don't get a cut in line just because we didn't have an income strategy, we didn't have a tax strategy to keep you in the lower brackets. So if there's one slide I want to hand to every person that's 60 years and older, this is something that with a little bit of planning can save you tens of thousands of dollars over your entire retirement just by putting a plan around this. Matt, I know this is a big slide for all of us. Did you want to add anything there?
No, Ken, you're spot on with this because a lot of people look at Medicare as just, oh, it's Medicare, right? Oh, it's my health insurance. Oh, it's this. And with the right planning, if you can keep your IRMA minimized, do the math. I mean, if you could save $10,000 a year, why wouldn't you? I
Yep.
mean, that's just common sense to me. Do the math, do it early. And Ken, you also made a great point. If you're 60, you should be thinking about this. Folks, I'll double down or triple down on that. Believe it or not, in your 40s, if you know anyone in their 40s, they should be thinking about this as well because they have time to set up their retirement structure so that they are not going to be in those higher tax brackets later on. So the earlier is the better.
Completely agree. But 59 is a magical age. It's the first time you can touch your piggy bank of retirement accounts and start moving them out of the 401k. But yes, start earlier. So the deductibles, this is what you pay. Now, this number, this is what's posted, but it changes depending on exactly what Medigap plans you have and you have in force. But at the core of it, the deductible for Part A, so just going into the hospital, you should expect about $1,600 is for your deductible. Part B is 257 and Part D for your medicine, just shy of 600 bucks a month. And so again, that adds up. Now, next slide.
Oh, Ken, not to
Oh,
sharpshoot you or anything, but 600 bucks
uh-huh.
a year is the out of
Sorry,
pocket.
did I say a month?
You did. Yeah. Okay.
Okay, okay.
All right.
Well, be
All right.
ready for it. It might be,
There you
depending on
go.
your illness. Yeah,
There you
yeah.
go.
Yeah. Okay. So then the co-insurance. So depending on what you're dealing with, Part A is $419, and that is after the first 60 days. So again, really relatively low cost. But then it gets more expensive, 838 for days 91 through 150. And then the skilled nursing cost is what you're paying is $209 for days 21 through 100. So if you have a quick illness, a quick bout that you're in and out of the hospital, Medicare Part A does a lot of the lifting. It's pretty much everything after day 20 that the bills really start racking up. And after day 150, whoa, okay. But that's where Part B also will help with some of those expenses. Most people have heard of an 80-20, where you cover 20%, Medicare covers the 80. That is the case for most services. So should be mentally prepared to cover 20% of the approved rate costs associated with your recovery. But as we know, that's not always a small number. So again, it adds up. Next slide. But then comes Part D. So now that you're back home and we have medications we're dealing with, the deductible is $590. So that first amount is out of your pocket. But then you're covering 25% up until $2,000. The other thing to note is you should really be shopping your pharmacy pretty much every single time that you are picking up a prescription. This is myself. I went to Walgreens, I looked at Sam's, and then there's this online pharmacy that I won't plug. Well, I guess I plugged Walgreens and whatever. It's Mark Cuban's Cost Plus pharmacy. And literally, my medication was 90% cheaper online than it was at Walgreens. And so, do yourself a service and look at where your prescriptions are coming from. And again, can make your dollars go a lot further. Um, so, what does Medicare cover? As we've described, it covers the first 60 days of the hospital visit. It'll cover some of the medical services that you're receiving, and it'll cover some of the preventative services like flu shots and regular maintenance items. But that's pretty much it. Everything else are things that you feel like you need, you should have, that Medicare, you would hope Medicare covers, but it doesn't. So one of the most common things people believe is it covers your long-term care. As I mentioned, after 20 days, your hospital bills start getting more and more expensive. If you're needing in-home care, Medicare isn't going to cover it. A lot of folks are going to need some either vision care. We were talking about all the different prescriptions. Matt is juggling around in the glasses and readers that he has. That's all not covered by Medicare. Same thing with hearing aids and cosmetic surgery. And it's not just about cosmetic surgery to look better, but there are instances where a person has a car accident or a fall or whatever it is. It's not just a pullback or any kind of facelift. It's just to get you back to where you need to be. That is technically still cosmetic surgery, and that is not covered by Medicare. So where are these expenses going to be covered? Next. And so this is where private insurance can really come in. So some of your private insurance can help cover some of the deductibles that you're dealing with. They may also fully cover a portion, if not all, of the prescription drugs that you're dealing with. It is highly encouraged that you look at getting a supplemental insurance, one way or the other, that covers your needs to help with these expenses. Matt, were you going to say something?
Nope.
Nope. Okay. That you're raising your hand. Okay.
Nope.
Next slide. And that's where we talk about Medigap. So you have your baseline Medicare, and that's what you've been paying for your whole time. But there are probably things that you want above and beyond that Medicare isn't covering, and Medigap fills in those gaps. The good news, bad news is it's relatively standardized, but there are a lot of different options to be weighing into. It is an additional monthly premium, and costs vary by plan, company, but even location. It's down to the zip code that determines what cost you're ultimately going to be paying. And just like with other retirement plans, just because your neighbor does this, your coworker, your aunt, your uncle, your cousin, you really should be looking at what you need, because plans are going to vary based off of a number of factors that really only apply to you.
And can I add one comment to this?
Please.
The last word on this slide is location. Folks, it is zip code matters. Okay, so your sister, brother, cousin, whomever might live 20 miles away from you and have a different cost than you do, and maybe theirs is a little lower. Location matters. It absolutely does. So keep in mind, costs, like Ken said, they are going to vary for these Medigap plans. They are not uniform at all. The services are standardized, but the costs are not.
No. All right. So if you're confused by Medicare A, B, C, and D, you're definitely going to be confused here. And don't blame us. Please write your congressman to get this fixed. But your Medigap plans are A through N, and they skip a bunch of letters for no discernible reason either. When looking at this, there are different benefits that come with the different Medicare plans. The one that stands out to me, that applies to a lot of our clients, honestly comes down to that very last one: foreign travel. If you see yourself traveling internationally, it is really important that you're looking at plans C through G because it will help cover some of those medical expenses. If you look at plan F, it covers, F for full coverage. It covers as much as it possibly can for all of your different wants and needs. But you can also imagine that cost is also a lot higher than, say, Medigap Plan A, which seems to cover the least. Matt, do you want to take a moment and just talk about how real a medical emergency can happen when you're traveling abroad? I know you have, I think, three
Yeah, yeah,
stories.
yeah. The only one I'll touch on is my parents were in Central Asia, and my dad passed out on a getting on a tour bus somewhere, and they got him. They took him to the local doctors, and they did a fantastic job. Now, I grew up in Minnesota. That's where my parents live. They put him on the next flight home. He flew, and folks, he was in his late 70s, early 80s when this happened. So they put him on a plane. They fly him home to Minnesota. They told him go to the Mayo Clinic because the Mayo Clinic has translators who can actually decipher our doctor notes from the incident. Now, the reason I say that is I'm pretty sure they were in Kazakhstan, but I don't know for sure if that's the country they were in. I'm pretty sure that's where they were when it happened. However, they get him back to the Mayo Clinic after 20 hours of flight time, right? And he ends up having quadruple bypass surgery. I mean, yeah. So, they didn't have to pay for the foreign travel emergency. I mean, or anywhere near what they should have paid. Because when you read the fine print on Medicare, yeah, there's even this even applies to U.S. doctors. The Ken talked about the excess premium, the excess charge. You pay 80, they pay 20. Well, if the doctor's charging above and beyond that 20, guess who pays it? You do. Medicare doesn't pick 80% of the whole bill. Medicare picks up 80% of the standardized cost for the procedure. You pay the other 20%. And oh, by the way, if the doctor is super great at it and he charges a premium, you're going to pay the premium, right? Those doctors in Kazakhstan or whatever, they charged as much as they could. You know why? Because it was an American. So think about that. You're not thinking about that in the moment. You're thinking, oh my God, what just happened, right? But if you are planning on traveling a lot, you seriously need to think about this stuff as opposed to, yeah, we'll go, it'll be fine. You don't know.
Now, you mentioned that they also had translators and such, but I thought translators are always required because nobody could read doctor's handwriting.
Yeah, that's a great point. That's a
Okay.
good point.
So you can shop your Part B and your Part D and figure out which one makes the most sense for you. But you could also get it all bundled into one, and this is Medicare Part C. This is Medicare Advantage plans, where all of it's done at once. Now, within these plans, the good thing about it is that, again, it's one thing you're shopping for, but there's a lot of clauses that you really need to understand just as much as if you're shopping individually to make sure that your plan is covering all of your needs. So, are your doctors in network? The prescription drugs that you're taking and may take in the future based off of, your diagnoses that might get better or worse. What are some future drugs that you might be needing to have? Does it include vision or dental? And there might be different cost sharing benefits that differ from plan to plan. One thing that I don't think we've touched on enough is signing up for this at 65 is going to be overwhelming and it has to be done. The bad news is that you should probably be doing this at minimum every 2, if not 3, or 3 years, if not every 2 years. Be reshopping your plan, going through this process because you're going to be prescribed new medicine. Your doctors are going to change networks. There are things, and there's going to be laws that change. So making sure that you are most up to date is key. So while Medigap plans are standardized, premiums can vary considerably. The drug plans do change a lot. And again, this is down to zip code that your metformin is more expensive in one zip code than another one. It's just the way it is and making sure you're aware of it. But then also the Medicare Advantage plans, they vary considerably. sit down with us. We'll connect you with a professional, but we'll make sure that at the end of the day, you have the medical services that you need, you want, and deserve. So, what else do we need to scare them about, Matt?
Well, it's the cheapest it's ever gonna be. How about that? So
Sure.
let's talk about planning for higher costs. Okay, here's a breakdown for you. Um, Out-of-pocket healthcare spending by gender and age. This goes back to a point I made earlier that hey, if you take great care of yourself, odds are you're going to live longer. Well, guess what? Look at who pays the most. The people who live the longest, right? Um, and you can see that over time it grows. Okay. And it's something that you just need to make sure that you're thinking, hey, it's not just the premiums, it's also the services that I'm paying for as well. This also goes back to what Ken mentioned earlier about income planning. You may be this couple, on with the men at 85 plus and women at 85 plus. Look at what that adds up to. About $20,000 a year. Okay. Maybe you were traveling and spending 15 to 20,000 a year. Maybe you were giving the kids or the grandkids 15 or 20,000 a year. And this is something that we always hear people say, "Oh, well, my life is going to stink at that point, so I'm just going to go do whatever. I'm going to do whatever, and I won't be spending as much." We hear that a lot from people. You're going to spend every bit as much as you did early on. You're just going to be spending it on different things. Healthcare is going to become a bigger part of your budget the older you get. So you just need to be prepared for it above all else. Typical budget today. This is if you can hit the minimums. Okay, you're at about 425 per person, so about 850 per person. When I first got started, people used to say, "Oh, that's a mortgage." Now I kind of say, "Oh, that's a car payment." 850 a month per household. Keep in mind what Ken mentioned earlier in terms of IRMA, though. Could it be 1,500 a month? You bet it could. You bet it could. So planning in your 40s and 50s and even your early 60s can do a lot to make sure that this part of the budget does not get out of control. Typically, if you were to build this out into a budget, you can see you've got some insurance premiums, out-of-pocket costs for the drugs, dental, vision, and maybe some other care as well. $7,000 a person. Okay, $7,000 a person. So what causes it to go up? The premiums go up. That $185, if you're at that level, it's not going to be $185 forever. It seems like just a few years ago, it was $143 per person, right? Those premiums continue to go up. And there's nothing to say that Congress can't pass a law that says, hey, we're going to offer or cover fewer and fewer services with Medicare. Right now, the four big ones that you really need to think about are dental, vision, hearing, and long-term care. We get a lot of people who get confused about long-term care. They think that the nursing benefit from Medicare covers them for 100 days. Nursing care is what's also called acute care. Long-term care is what's called chronic care. Acute care means a nurse or a doctor is prescribing and helping you take things like medication. Long-term care or extended care is getting out of bed, being able to take a bath, changing your clothes, things like that. Medicare does not touch long-term care with a 10-foot pole. Okay. It does not touch it at all. And I've had many people over the years tell me, oh, well, I'll just spend all my assets down and I'll go on Medicaid if that is really what happens. And I just say one thing at that point. I'd actually just say one word. Really? That's what you want? That's what the last few years of your life, you really want it to be like that? That's what your family wants for you? I don't think that's realistic. So planning for future healthcare costs, you want a budget for a married couple somewhere between $300,000 and $350,000 over the course of a 30-year retirement. So you can see Fidelity, you can see the Employee Benefit Research Institute. These are both great organizations. They do annual surveys on this where they're trying to forecast out what those costs are going to look like. So from a planning standpoint, if you're trying to peg an actual number to it, 330 to 351, hey, what's that up? What's that broken down over the course of 30 years? About $10,000 to $12,000 a year is what that works out to. Okay, long-term care, I touched on this. Skilled nursing care, activities of daily living. Activities of daily living there's 6 of them. For most long-term care, pretty much every long-term care claim that's out there, You just need to be able to prove you cannot do 2 out of the 6 long-term care activities of daily living. There's a lot of data that backs up why you're going to need to get that extra coverage and make sure you've got it. The biggest thing I would say, folks, on this is, and here's your 6 activities of daily living right here: bathing and showering, dressing, eating, getting in and out of bed or chairs, walking, or using the toilet. Getting in and out of bed or chairs, that's called transferring as well. So if you've seen that term, that's what that means. So one of the things I think our industry's done a terrible job on is saying, oh, look at the statistics, look at the data, blah, 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 blah. What I really want you to think about is, what does this do to your spouse? Having to get you in and out of the shower, having to help you get dressed, having to help you eat a meal, pulling you out of bed, helping you walk, or helping you use a toilet. Can your spouse do that? And we have some people say, oh, my kids will do it. Yeah, they'll do it because they love you, and they're going to have to take on not just their responsibilities as a parent and someone who works full-time, but no, another full-time job taking care of you. And so, folks, when you think about long-term care planning as part of your healthcare plan, I want you to think about it just like when you were 35 years old and you bought a term insurance policy. Why'd you do that? To take care of your family in case something happened to you. Why do you get extended or long-term care coverage? To go with your Medicare plans? To take care of your family so they can take care of you in the best way possible. So this is something you absolutely have to plan for when you're working. Or earlier, sorry, you should be planning for this much earlier than later. Don't get in your mid-60s and suddenly the light bulb goes on. Do this as early as you can. There's instrumental activities of daily living. Those do not qualify for long-term care coverage. Usually, a lot of people are getting help with stuff like this, right? Maybe someone's coming over to do some housework because your knees aren't working as well as they used to, right? Or maybe, you struggle cooking now or something like that. So you might be getting some of these things. Here is where you do get into the activities of daily living, and that's what's called custodial care or chronic care, which is not covered by Medicare. Skilled nursing care is covered by Medicare, but just for the first 100 days. And Ken, I believe the number was $280 a day after day 20,
Yep,
right?
that's it. Mm-hmm.
That's it. So you are on the hook for the rest of it, whatever it might be after day 20, unless you have one of the better Medigap plans. And even then, it might not cover the whole thing. Some of the costs, I'm not going to beat the costs too hard with this. When we do stress testing for people with this as part of their overall retirement plan, what we're looking at is not just, hey, what's this going to cost? But we look at the tax implications of dealing with a serious healthcare issue. Because you get over certain minimum thresholds of adjusted gross income being spent on healthcare, it becomes fully deductible to you. You may have a lot of savings. You may need to get some type of insurance plan that will also cover long-term care, but you might not. Maybe you can segregate some funds and use those wisely. So they're a pool of money waiting for you if you ever need this type of care. So is it expensive? Yes. Don't focus too much on the numbers. Focus more on, hey, if I can't do these things myself, how's it going to get done? Who do I want to do it? And will my family be involved? You bet they will. They're going to supervise it no matter what. But it's a whole different animal to supervise it versus to actually having to do the physical work. So touched on this already. Going back to our 3 reminders, and I guess this is where I turn it back over to Ken to take us home. So Ken,
Sure.
go
So
ahead.
step 1, enroll in Medicare on time. Before your 65th birthday, within 2 to 3 months of you separating from work, if you are in a covered job, just go ahead and do it. It's one of those easiest things to do, that will save you thousands of dollars by not missing it. Set an alarm, enroll in Medicare on time. Shop carefully for private insurance to go with your Medicare. Again, this is something that in a perfect world you're doing every single year, at least every other year overall, to make sure that your plan covers your needs, but you're also not overpaying as well. There are a lot of costs, but you don't have to do this alone. Utilize us, utilize our team to help make sure that your plan is the right one. Plan for high healthcare costs in retirement. Please, 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 if you haven't had a discussion with us already, I want to emphasize, bold, highlight, plan. When it comes for healthcare, when it comes for Medicare, there are many ways to have this covered. You do not have to have a long-term care insurance policy. You don't have to have one. We would highly recommend you have a way to have $5,000 to $10,000 a month to cover those costs, but it does not need to be a long-term care insurance plan. Now, what are the different ways we can self-fund? Everything from your retirement accounts. Maybe it's taking a look at reverse mortgage that might make sense for you, or a HELOC, a home equity line of credit. There's multiple ways to cover these costs, but we have to plan for it. And it's only going to get more expensive. Inflation lately has been around 3 to 4%. Do you know what's been around 7 to 8%? Medical costs. And it hasn't slowed down in the last decade, and it's not going to slow down over the next one. So please be prepared. It's the only thing that we can control is where we put our time and energy into, and a few hours tops on this side of a medical emergency, on this side of your retirement, will save you, your family, your loved ones, hours and months and years of headache and heartache by failing to plan. So please, 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 please take a moment. Matt, was I clear?
That was very clear. The only thing I would add is backache as well. Headache, heartache, and backache. That's the only thing I would add. Folks, this is a lot to go through in about 50 minutes. You're going to have follow-up questions. Please reach out. You can call us toll free. You can go to our website and click on the Contact Us tab. The biggest thing I'd say, though, is just to stress what Ken already talked about. Plan, plan, plan. The value is in the planning, right? And your plan is not Ken's plan, is not my plan. It is your plan. And that's why we look at it from really a 5 pillars strategy. And that 5 pillar strategy, guess what pillar 3 is? Insurance planning, healthcare planning. What is the plan? Because your estate plan, your taxes, your spending, your income, your assets, it all blows up if you don't have a plan for healthcare. So get a plan, get a hold of us. We can help you plan. Again, feel free to reach out, 888-339-0093. Go to our website, missionfinancialplanners.com. Check out our YouTube channel as well. But otherwise, thanks again, everyone. And we'll look forward to seeing you for next month, which I believe we're talking about cybersecurity next month, Kat.
Oh, okay.
So
that's a good one.
Should be very useful for a lot of people. All right. Thanks again, everyone. And have a great rest of your week. Bye-bye.
Take care.